our vision is to become the go-to platform for South Asians looking for culturally compassionate healthcare. In the next few years, I really want to continue to grow our provider directory so it's truly national and build out a robust resource hub with a lot of evidence-based, culturally relevant content, and also just expand our events, both from virtual to in person, so more people can feel connected and supported. So ultimately, the goal is to make navigating healthcare less isolating and just more empowering for South Asian individuals and families. Since all of our work is virtual and fairly accessible virtually, it has spanned the United States. We have a lot of people mainly from the larger cities in the United States, but I want to continue to grow that. I mean, it'd be amazing if we could create this into a global thing too. Would truly be a dream come true.
Hey friends, I'm Omari Richins, founder of the Public Health Millennial and host of Public Health Careers. Join us as we dive deep into public health topics and career journeys. You hear diverse career stories, absorb professional development and career strategies to help you learn, navigate, and transform your public health journey. On today's episode, we have Nishat Uddin. Nishat is the founder and CEO at South Asian Care. She's a passionate public health leader and communicator with a career that bridges health equity, strategic communications, and culturally responsive care. Nishat brings years of healthcare public relations experience with top global firms and now leads South Asian Care, a digital platform aimed at destigmatizing health and improving culturally competent care access for the South Asian community. She conferred a bachelor's in science in public health and a bachelor's of arts in psychology at the University of California, San Diego, then a master of public health specialization in communications and marketing at the George Washington University Milken Institute School of Public Health. In today's episode, you'll hear and learn more about why and how she built South Asian Care to meet the health and culturally compassionate needs of that population, why building communication strategies requires balancing scientific accuracy with storytelling, and how storytelling can be used to make health data relatable and impactful. Why building trust is crucial for effective public health initiatives and meeting the community where they're at. Why it's important to trust your instincts, stay curious, and learn as you go when making career decisions, and much, much more. Be sure to hit that subscribe button, that like button, and enjoy today's episode.
Hey, this is Nishat Uddin. I am the founder and CEO of South Asian Care, and you are listening to Public Health Careers.
Nishat, I'm so excited to have you on the show today and learn more about your journey in public health. Welcome to the show.
Thanks so much for having me today.
Truly, truly my pleasure. And before we jump into any of your career and expertise, we'd love to know how you identify and tell us a little about your personal background.
Yeah, sure. Happy to tell you a little bit about myself. So, I identify as a South Asian woman with Bangladeshi roots. I was born and raised in the United States. I've lived a few different parts of the country. I was born and raised in Orlando, Florida, and I'm currently based in Los Angeles, California. I've been out here for a little bit. Outside of public health, I love cooking, especially exploring cultural dishes and trying new recipes.
What's your favorite thing to cook?
I like a good traditional chicken curry.
Love it, love it, love it.
Appreciate you sharing that. And what was that like for you, or what has it been like for you living well, moving from Florida to the West Coast?
Similar but different. I think they both have very different cultures, slightly similar climates depending on where you are. But I think it's been a really great change in many, many ways. Being able to explore kind of the East and the South versus the West Coast has kind of broadened my horizons and I has given me the opportunity to explore different networks, meet different types of people, and just learn a lot. I've done my education both on the East and West Coast, so it's been nice to be able to experience both worlds of things.
Yeah, like that, and I appreciate that, and I could imagine the same and different, and I think it's so important just to kind of think about our journeys and think about how we've grown in the places and how that relates. And I'm intrigued because you, as we'll learn about later, you're like founder and CEO of South Asian Care, and this is an organization that you opened up in the West Coast now. So I was kind of like, before, I guess I'm interested. So how did that kind of come up for you to think about starting this new organization?
Yeah, yeah. It really kind of bridged from both my cultural background and just kind of the things I learned both in my personal life and in my professional life. As I have my background, I have my Master of Public Health, and through that, I learned a lot about community health. And through that, I was able to kind of relate it back to my own culture, my own background, and things that I felt like were gaps or missing in my community, which would be the South Asian community. And so that's kind of how I led to create South Asian Care, because I felt that there were gaps and there were messages and education that were missing in, my family, my friends, my groups of people. And I really wanted to make it easier, and, make healthcare more equitable for my community especially, but also people as a whole. Many different groups of people have these gaps, and I wanted to kind of use my personal passion to bring it back to my own community.
And I love this about people in public health, like just finding that intersection between like the personal passions and the things that they care about, and really trying to like work within that realm. And I feel like that's one of the things that public health kind of allows you to do. So I got ahead of myself a little bit. So to bring us back, I know that you have some experience and with like public health communications. So what first drew you to health communications or public health comms?
Yeah, definitely. So I think even before I started my MPH, I really knew I wanted to focus on health communications. I've always just been really fascinated by how we share information and how that can really shape how people understand and how they act on it. I saw really early on that, a lot of health messages weren't connecting with the very people they were intended for, especially, South Asian communities and other groups of people. So I realized that it made me want to focus on bridging that gap and giving people, more relatable and culturally sensitive information. So I think that really I had the passion from day one, and it kind of led me into the career of health communications in the public health world.
And what kind of still excites you about or challenges you in how we communicate or how we think about health communication, considering that context?
Yeah, I think what excites me is how much potential there is to just meet people where they are, whether that's through social media, community conversations, or storytelling that really reflects people's experiences. I think the challenge is that health communication is rarely one size fits all. And we really have to think about language, cultural nuances, and trust, and sometimes even rethinking strategies on how they truly resonate with different communities. So I think it's, an an always changing landscape, and every group of people will be different and every message will be different. So I find it really interesting on, tailoring things to that work for different groups of people.
Yeah, absolutely. And that I feel like we talk about this a lot in public health, but like, you have to understand the
Mhm.
community and their specific needs, ways they talk about things to be able to reach them. And I think it continues to be highlighted in, I feel like the work from like the pandemic up to now, probably even before the pandemic, but especially in the pandemic, just how we communicate with communities is so important, and creating like those pathways for communication and partnerships, I would say as well.
Exactly, exactly.
And in your opinion, what are some of the biggest gaps in how public health messaging is crafted and shared, especially across diverse communities?
Yeah, I think one of the biggest gaps is that public health messaging often assumes a universal audience. We sometimes focus on much of the science that we forget to look at people's lived realities of different communities. So, for diverse communities like South Asian communities, that can mean messages don't account for cultural beliefs, stigma, languages, and another thing is gap of trust. We can have the best data, but if the messenger doesn't feel credible or relatable to the community, then the messages just won't land, and then it takes away from the effectiveness of any campaign.
Absolutely, absolutely. I think those are like some especially important things to think about. So considering like the work that you do specific with the South Asian population, and considering like we just shared that there are different like cultural nuances across not only I guess here in the US but
Mhm.
across countries and cultures. What are some of the ways that you all think about reaching or having conversations around with those different like cultural aspects, and knowing that people who identify as South Asian are not a monolith.
Yeah, absolutely. I think it's just making our information and our messages really accessible and broad enough that people can understand but can relate. Also giving a plethora of information that, people can see what relates to them depending on where they're from, what language they speak, whether that's, providing different statistics from different regions of the South Asian population, or, even offering a lot of materials in different languages. That's something that we're really striving to do. And also making things relatable to people and, whatever it is that they are looking for. Sometimes it's hard to see yourself in data. So putting out personal experiences, putting out patient stories, things like that to just make it more accessible for people and also easy to understand. If we're looking at a community member, they might not have all the medical terminology. So making it easier for them to understand, digest more about their health and finding it relatable to their needs.
Absolutely. And well, I guess hitting on the tenets of like public health, meeting the community where they're at, creating messaging
Yeah.
that relates to them in specific ways. Are there specific gaps or maybe not gaps, disparities, needs, challenges that you are
Yeah.
seeing currently with South Asian populations?
Yeah, there's quite a few, and I think that's kind of like the whole premise that there's so many gaps that I see in the community as far as, the healthcare world. I think a large part is there's a lot of stigma behind a lot of topics. And because of that, quite a bit of a lack of education around them. So, for instance, mental health, that's one. For many, many years, that has been quite stigmatized in South Asian communities, not spoken about. Therefore, there's not many resources. So I think a lot of it is due to stigma. There's not many resources. So what we are trying to do too with our organization is break down those hard to talk about topics, making it accessible and making it normalized to speak on things that are not always comfortable or always spoken about in households. So that's a large one. Also just culturally accessible information. So whether that is language, regional, different needs for different groups of people and, just making healthcare more accessible to them. For instance, if there is an individual who doesn't speak English, but they speak Bengali and they're looking for a healthcare provider, it's not always easy for them living in the United States. So we're trying to bridge that gap by creating a directory that shows them, who speaks their similar languages, who can give them the care and communicate well with them so that they don't have those gaps in healthcare and that they're able to receive the care that they are well deserved. So there are many gaps in the South Asian community that we see, and slowly but surely we're trying to bridge those. And a lot of it starts with the communication, the education, and then just being kind of a trusted resource and also a comfortable resource for them where they feel like they can come and learn more to bridge those gaps.
Yeah, I love that, and I think like building that trust is something that I think, especially when we look at like I think pandemic is a good case study when we see
Yeah.
the historically marginalized populations not getting the care that they need, the vaccines that they need, because they've never had those trusted partners or people who can share those messages, and just how important that is to build on the front end before anything, I think is so important. Um,
Yeah.
yeah, and I appreciate you lifting up some of like those gaps are like mental health and stigma, and starting to have the conversation, which I think is so important, so that people, so it's more normalized, and it's not something that's on the outskirts of the community, but we can lift up and create resources and ways for people to better understand and navigate that. And then even as you're talking about the directory, I think that is hugely important and beneficial when we look to the literature. I don't know what literature says specifically for like South Asians, but when we look at the literature for like Black Americans or Black people and being taken care of by a Black doctor, you have better outcomes, you have better understanding across the people. So I can see why like that is also a big need, as well as like a huge way to create not only access, but probably even more equitable and culturally responsive access, which is key in many cases.
Yeah, exactly. And just to add on to that too, a lot of populations, specifically the South Asian community, we are disproportionately impacted by, specific things like diabetes, cardiovascular health. So I think that's another thing that makes having culturally compassionate healthcare important because not all providers will be able to have that cultural context in speaking with their patients. So it just makes, the healthcare and the trust that much more important, and accessible to them. So I think it's just kind of bridging that gap and tying those things really close together.
And thinking about like health systems and health messages,
Mhm.
what are ways that we can design systems or messages that better acknowledge the stigma, cultural stigma, as well as generational trauma in health?
Yeah, I think first it really starts with listening. We can't design messages or systems for communities without understanding their histories and lived experiences first, especially where stigma or generational trauma plays a role. I think it's really about creating space for those stories to be heard and then shaping communication that reflects those understandings. So that might mean changing the language we use, involving trusted communities' voices as messengers and kind of those patient stories that I was mentioning, or even reframing issues in ways that feel just less judgmental and more supportive. So when people feel seen and respected, they're more likely to engage with that information.
Love that. And I'm thinking about as you said that, I was thinking about like asset based language and like how important it is to frame things in an asset based way so that people
Mhm,
are seeing themselves as more than just their disease or their issue or the illness or in front of them, but understanding that they are a lot more than just that, and they might be just
mhm,
experiencing this illness, experiencing homelessness, and really bringing that
mhm.
compassion is so important.
Exactly. Yeah.
And you kind of spoke about storytelling as part of the messaging for community and like health education. How do you think about storytelling as a tool for both advocacy and
Mhm.
education?
Yeah, I think storytelling really humanizes the data that we have and that we often use in public health. I think statistics alone really inspire action, but when you pair them with a real person's experience, such as a patient navigating PCOS or a provider speaking about stigma, or even my own story of why I started this work, it becomes relatable and memorable. So I try to use storytelling to break down taboos and show that these challenges are shared amongst people and not just isolated. So it really builds empathy and helps people see themselves in the message and makes the educational stick out in a way that is more impactful than a fact sheet on its own. Not to say fact sheets are not important. They very much are, and we have a lot of those as well, but kind of adding those multi-dimensional layers to it really makes the storytelling more impactful to patient populations.
And do you have an example of a community driven communication process?
Yeah, a lot of our things are co-created with our community, so we will incorporate them in the messages we're putting together or even the campaigns we're putting together. So, for instance, PCOS Awareness Month, we kind of highlighted different people who had lived experiences with PCOS, talked about, kind of their journey with it, their journey to receiving healthcare, and we put that into, it wasn't just we use their storytelling to make our campaign more impactful for PCOS Awareness Month and creating a broader community driven campaign strategy. So we really like to do that because I think it's important when people hear about things, from the patient perspective, especially for stigmatized topics, because they can see, okay, we're talking about it. It's out in the public. We can definitely have these conversations. It's not meant to just be kept silent, and also, it makes people more comfortable and have more of a resource to learn about things that aren't always talked about in their own households or families. So I think we really do try to co-create content with our community to encourage more of that storytelling and personable, um, content.
And what does that co-creation look like for you all? Is that like focus groups or just getting feedback on things that you're putting out, or what exactly?
Yeah, we're always looking for feedback from different groups of populations, and a lot of we do community events and webinars and things that different groups of people can join, and a lot of that is dialogue. We have conversations about, what they would want to see on our platform, what they would like to contribute to our platform. So we're always having people who, are sharing kind of their feedback of what they want to hear, and also people who are volunteering to share their own stories. So a little bit of both, but we're always, keeping close touch with our community members on how we can put their stories out there. But also, in addition to kind of the community and patient side, we work really closely with providers. So we're always working with many different providers, both on our directory and other organizations as well, on things that they're really passionate about education wise that they think would be impactful, or things that they're seeing in their own practices that they believe that needs to be spoken about more. So we work both with the provider and the patient communities to get that information out there.
Awesome, awesome. I definitely have more questions on that, but I want to run through some of your like career story, and then we can get back to South
Yeah.
Asian care. So before we get into your academic pathway, would love to know, what does public health mean to you?
Yeah, great question. For me, public health is about creating the conditions where everyone has fair chance to live healthy and fulfilling lives. I think it really goes beyond individual care, and it's truly about access, equity, and making sure information and resources reach people in ways that respect their culture and their experiences. So I really see it as a bridge between science, communities, and also real world change.
And before we get into your academic pathway, did you think that you would be doing the work that you're doing now when you started your like bachelor's undergrad journey?
Honestly, no, not
What
at all.
what do you think you'd be doing?
To be quite honest, I wasn't sure exactly what I would be doing. But if I had to put it into words, I think this is kind of the dream job. I had a lot of passions, and at a younger age, I wasn't exactly sure how to make it all come together. And through experiences and education, I see this as exactly what I would have loved to do from my younger age.
Awesome. Well, I'm excited to hear about how you were able to get there, not knowing that. So Nishat started off getting a, well, I don't know if you started off, you ended up getting a bachelor's of science in public health and a bachelor's of arts in psychology at UC San Diego. Walk us through that thought process of going to undergrad, as well as I'd imagine this was the first time you moved from Florida to California.
Yep, yep, it definitely was. So this was when I first moved out to California. I was in San Diego for a few years. So kind of my thought process about this route, going into college, I knew I wanted to be in a field that focused on people's well-being, but I wasn't quite set on a clinical path. I think through my understanding, public health caught my attention early on because it looked at health from a systems and population level. So pairing it with psychology just felt natural to me, and really just sparked my interest in learning about people's behaviors, motivation, and the human side of health decisions. So I kind of really let my passion and my interest guide me, and that's kind of a little bit about how I ended up getting my Bachelor of Science in Public Health and then psychology as well.
And was there any like one moment or moments that kind of led to you saying, yes, I want to do this study of public health?
I think so. I still remember it was some of my first classes I took in my public health program. And I just remember feeling such a connection and interest and passion for it that I realized in that very moment, I was like, I want to do this long term. This feels right. And I feel passionate. And I feel like there's so many opportunities in this field for me to make a difference and learn from.
Yeah, and you created your own opportunity as well, which I think is very telling.
Thank you.
Were there any undergrad takeaways or eye-opening experiences that you wanted to share with us?
I think one of my biggest takeaways from undergrad was just realizing how much you can learn outside the classroom. I think being part of research projects, student organizations, and just volunteering in local communities helped me see how public health theory translates into real world impact. So I think that's a big thing that I would recommend to, other people starting their education journey is to really just get involved in all the things that are available to you because that really increases your opportunity to learn and also just network because I think the knowledge that other people can bring is so important and, will be very, very crucial to your whole journey. So I think that's probably one big takeaway I had.
Yep. And one of the things that was, I guess, curious to me is that I thought that you did your bachelor's on the East Coast and then went for your master's on the West Coast, but you did your bachelor's firstly on the West Coast. What was that like for you in terms of like support system and being able to, I don't know, have a community there for you?
Yeah, it actually was a complete blank slate. And I actually think that was, both eye-opening and a really great learning experience. I mean, I was young, I think 18 at the time, moving across country and, starting on this whole new journey. But I think I am thankful that it was for an undergraduate program because a lot of people are in the same boat, whether they come from close or far, everyone's kind of there with the same purpose. So, it was nice and challenging, but I was able to kind of build and create an own new community for myself. I really, really, loved my peers at my program, and over some time, I was able to kind of create that support group for myself. And even though, family was far, they were always a constant support for me throughout my whole journey and, even now in my career. So I always felt that sense of, familial support, but I was always also able to kind of build my own network at my program and have that support just from day to day being at school on the West Coast.
Yeah, I love that. And very real perspective. Everyone is coming from far or close and trying to build up those connections. And I feel like
Hmm.
undergrad is an amazing time to build connections. And to your point earlier, like build experiences and get involved in things to really kind of figure out more about yourself and where you may fit in this world.
Exactly, and I feel like that's just one of the main times in life, like, once you are out of your academic journey, it is a little harder or
Hmm.
different, I should say, so I think that's really great advice for someone who is starting their undergraduate career just to get involved in whatever piques your interest and, try different things, get involved in different things, meet different people. I think that is one really great thing you can do in undergraduate.
Yeah, plus one to that. And after your bachelor's, you came up back to the East Coast. You got your master's of
Yeah.
public health at George Washington University Milken Institute School of Public Health. Tell us about that thought process for, I guess, both moving back to the East Coast as well as deciding to get a master's of public health.
Yeah, definitely. So, I mean, from undergrad, I had a really big passion for public health. I knew that was exactly what I wanted to continue doing and have a more specialized degree for it. So, I was specifically looking for a program that had a track for communications and marketing. Only a handful of MPH programs actually offer that in the United States. So GW was definitely a draw because it had a program for that, and it was also a well-known program that I was really fond of. So I think also being in DC was something that really stuck out to me because it just gives you a lot of access to so many things happening in the city. And a lot of key organizations are based from there. And I also was just interested in, trying a new environment, being young and having the opportunity to explore. So I took that as a really great opportunity to move to DC, and that is how I ended up at GW.
Awesome, awesome. And what was that experience like for you? And were there any key like internships or experiences that really stand out that you wanted to share?
Yeah, I really, really enjoyed my program. I was only there for about a year, so it was a very quick program, but over that time, I really enjoyed going to the Milken School, and I thought like the people were amazing, the professors were incredible. I did participate in a lot of different kinds of programs. I worked with the baby's first test with the Genetic Alliance, and I helped with some literature reviews for them. So I was able to get my hands on some experience while I was in DC for local organizations. And there were just so many things happening around campus, whether it was a speaker, a seminar, there were always things happening, and I tried to really participate with as many of those things as I could. And also, there were just a lot of things happening in the city. Being in DC, it was a really exciting environment. Even outside of the program, there were always things to be a part of. Also, just amazing things to see, like the monuments around me. So it was a really eye-opening experience. And I think I felt like I was really well prepared from my MPH program to take on the real world, you could say, afterwards and kind of jumpstart my career. And it was also just really interesting, and I'm glad I was able to pursue that because being able to learn things that you're interested in is very, very, it sparks something in you. So I had an overall really great experience going there.
Awesome. Well, I'm glad to hear that. And I guess during your MPH, was there any thought from you on like building out South Asian care, or is this still not something that's in your mind at the moment?
At that very moment, no, I didn't have the specific ideation, but I think I always kind of had an entrepreneurial spirit in me. So I knew or I felt that I eventually wanted to create something with my passions. But I wasn't quite there yet when I was in my program. I knew I wanted to get kind of some experience working for different organizations before I ultimately was able to build something for myself.
Absolutely. Were there any key takeaways from your MPH program, or mentors or skills that have stuck with you to this day?
Yeah, I think similarly, key takeaways is to just get involved in literally everything, participate in everything that you can. And especially in a graduate degree, I think it's very important to create those networks because a lot of times those people who are in your cohort or your programs will end up being possibly your coworkers or your co-founders. You never know. And, those are some of the most brilliant minds and people who are on a similar track than you, similar track as you. So, I really think it's important to network in a graduate program. That is probably one of the biggest things because you will see them in the real world after you're out of school too.
Yeah, absolutely. And be nice to people. You never know who's
Hmm.
going to be where, and
Exactly.
and who's going to be able to help you. So, yeah,
Exactly.
yeah, that's very, very real. Um, so then after your master's of public health, you moved into some communication roles. You worked at places like Patient Pop, Weber Shandwick, and Real Chemistry. How did those shape your communication strategy skills, as well as give me a timeline of when you moved back to the West Coast?
Yeah, so I'll start by talking about the timeline. So I actually moved back to the West Coast probably days after graduation. It was very quick. So I was doing some interviews in my last semester of graduate school, just to have something hopefully lined up once I was done. So I actually knew about my opportunity back in Los Angeles before I even graduated. So it was
Yeah.
just a matter of finishing up my program and graduating. So I moved out of DC just a few days after, moved back to the West Coast. And so I started my career at Patient Pop, which was a really great introduction to the intersection of technology and healthcare, a little bit different, but it gave me insight into how providers think about reaching and supporting patients. And so from there, my roles at Weber Shandwick and Real Chemistry exposed me to larger scale health campaigns, and they were more teaching me how to build strategies that balance scientific accuracy with engaging storytelling. And also, altogether, those experiences really gave me a strong foundation in just really tailoring messages and how to reach different audiences. And it also really built the foundation for my later roles, which I continued to move on to other agencies as well. So after there, I moved on to GCI Health and also Edelman. So I was in kind of the agency world on the health communications and PR side for quite a few years.
Okay. And I like this. I like that how you're sharing like you're a patient pop, you're able to learn more about like the provider side of things. You're at Weber Shandwick, you're able to learn more about like the what do you say, the science and storytelling side of things, and it's kind of like building up, I feel like, to some of what you were able to build in South
Mhm.
Asian care. Um so maybe tell me before you share more about what you did as account director at GCI Health and vice
Okay.
president of health at Edelman. Um, what was kind of maybe your philosophy coming out of your master's program in looking for a career or finding work?
Yeah, I wanted to really work in something where I could build messages and reach different audiences. I also wanted to work in the excitement of an agency that was working on these really large campaigns that you see on TV, you see ads for, you see in medical offices or different facilities. I really wanted to be able to see from that side how things were crafted, how we worked with different companies and scientific data to put how it all basically comes to life because a lot of times you'll walk by and you'll see a poster and you won't think twice about what went into creating it. So I really wanted to be on the other side of that. So having these opportunities, I was able to work on the other side and it was really fascinating. And so I worked in a few different areas. So from for those who might not know, at an agency you have different clients and so I specifically worked in healthcare, but my clients spanned from specifically public health campaigns, but I also worked with medical devices, pharmaceutical companies, medical technology, so all in those areas. But my work was all around messaging and communications. But it was really interesting to see, some were more data focused than others, and it was really interesting to see how we could create that to very large scale campaigns.
Yeah, that's awesome. That's awesome. And when did you first get like introduced to the idea of like agency health comms work?
I actually heard about it a little bit in my master's program. I think it was actually my advisor at the time for my program who had been at some of these very large agencies. So he had told us a little bit kind of about his work there. I think he was there for like probably 20 years, so quite a bit of experience, and kind of educated us on what those roles look like and, you know, encouraged us to kind of seek those opportunities after our program.
Love that, and I think that's why it's like so key in kind of thinking about and choosing where you go to school because then they expose you to different things, and I feel like this is not maybe as common as a public health role, but many people in public health go into these kind of roles and can have an impact in it. Um,
Exactly.
uh, two questions. First one being, so you said that you were interviewing prior to grad school. You were able to get a position, I believe, before grad school and then move back days after graduation. To someone that is in their maybe last year of their Masters of Public Health program, how do you like advise them at this point in time to kind of think about the career field afterward?
Yeah, absolutely. So one thing I remember doing in my last semester, we actually had resources on our campus and in our program, and they're basically career planning resources. So I remember working on my resume at that time, and there were actually advisors who would help and sit down and review your resume with you, give advice, and just kind of educate you on how to strengthen that for getting ready to apply. So I definitely used the resources we had available on campus. Some people don't even know. I want to say most schools have those things
Mhm.
available to you. So I really did utilize that before, I knew I was just a few months out from graduating. So I wanted to make sure I use those resources. So I was able to use that to get my resume in a really strong place. And from there, I started applying online for roles that looked interesting to me. At that time, I was actually doing virtual interviews because I was still on the East Coast and I was looking on the West Coast too. But yeah, I was just kind of really focusing down to what was interesting to me and what I wanted to actually pursue after my program ended. I think one other thing I'd really recommend to others in that position too would be really use your network and your school's network. Sometimes they have relationships with different organizations or they have roles available that they can help place students with or at least make an introduction or pass a resume onto. I really, really think your network and networking is essential. One other thing I did do too was I actually attended different career fairs that my program was hosting. I think they did one maybe every semester. Those are very, very important for networking too. I think I'm honestly still connected to some of the people I met at that career fair many years ago. So, I think it's crucial to just talk to people, learn about what they do, get connected with different organizations, and then just prepare yourself as best as you can with your resume, your cover letters, because that will really put your foot forward.
Great insight for folks. And maybe another question. Granted, I know that you are amazing, Nishat. How many maybe like rejections or ghostings, maybe percentage wise, of the applications you applied to, just to give people maybe some context?
Yeah, I'll be honest, there were a lot, and there were days where I felt discouraged. I do think, job searching and job hunting is not easy, but it's worth it. And I think really just staying focused and not giving up from, 1 to 5, 10 rejections, because it is a very competitive market out there. But there are also, people who are focused and passionate. It's just a matter of the right opportunity. So myself, I did see rejections. I did get discouraged. I'm only human, but I kept applying, waiting for that right opportunity. And when it clicked, it clicked, but probably at least a dozen. So it takes time.
Yeah, I appreciate you sharing that. And a lot of what you shared is exactly the same kind of advice that I give to people. And for myself as well, I started looking for jobs, fellowships, like this semester when I was graduating next semester. And I think just having that long term view and giving yourself more runway and opportunities to get rejected and as well as accepted, I think is important in especially in today's job landscape. So I appreciate that.
Yeah. Yeah.
And did you want to share more about like what does an account director and vice president at these agencies do?
Yeah, so specifically, so I was an account director when I was at GCI Health, and so there's different levels, and you keep moving up and up. So that was my level at GCI Health, and so at the account director, I was managing different kinds of campaigns for pharmaceutical and health related clients. So that really helped me sharpen kind of my strategy. I was working on the strategy behind these campaigns. I was managing a few team members under me at that point. And also have been always client facing in these roles. So also kind of the project management on these different things, moving various projects forward, developing a lot of materials, working on, kind of as a public health person, kind of taking the data and the science and converting it into key messages. And from there, my team and I would put together these larger scale campaigns. I've worked on various different types of things, but just for example, one thing I worked on, this was actually before GCA Health, but this was at Weber Shandwick. But one thing that I find really cool is I worked on something called Cancer Screen Week, and that was in partnership with Genentech, and that was essentially a huge public health campaign about cancer screening and cancer awareness. So it was putting together a lot of the data and statistics in partnership with American Cancer Society as well, and putting it into relatable and digestible materials. We also had screening buses go in different parts of the United States, specifically in low income areas, to offer free cancer screenings in different communities. So that was honestly one of my big like career highlight moments because that was a very cool thing that I actually got to work on a really big public health campaign. So those were kind of the things that I would do in my positions. And then as I kind of moved up, so as I got to move up to account director at GCA Health, it was more kind of strategy oversight, team management. So I was able to get a lot more leadership experience. And as I grew, I was given more team members to manage, more client relationships. So that's kind of how my role developed over the years.
And how would you how were you able to do that, or how would you advise someone to think about maybe taking on some more leadership and like advancing in roles, whether at one organization or at other organizations?
Yeah, I think my biggest thing would be to be curious and ask a lot of questions. I think that's kind of how I thought I personally grew in a lot of my roles. For people who are more senior to me, I always took the time to kind of ask questions, how they got there, what the type of things that they did to help them get to that point of their careers. I would schedule a lot of one-on-ones with them, just really pick their brain about, their process and try to incorporate the feedback that they would give me, get involved in different parts, show initiative, even in, different parts of the organization besides kind of my work. I'd also get involved in like company culture and do different things so I could really network within my organization and kind of create more of a name for myself within my organization so that I could grow into those roles. And also just, being a hard worker, I was passionate about the work I was doing, so I'd always put my whole self forward into delivering great work. So I think just staying passionate, staying curious, and speaking with people and kind of their routes as well.
Awesome. Well, I appreciate you sharing that, and I think that's good
Yeah.
insights for folks. So after Edelman, you became founder and CEO of South Asian Care. You kind of spoke about it, like having an entrepreneurial spirit, um, and having like inklings to do work that is like passion oriented. How how did you go from working to then saying I'm gonna start and found this organization?
Yeah, so it's actually pretty interesting. So while I was working at my agency jobs, I've always kind of had these passions to create something for the South Asian community, but I was always kind of toying over the idea of how to do it or what to do, or you sometimes you would doubt yourself. I'm like, would people even care if I created something? So, just kind of working through those things internally. And while I was at my agency jobs, I created just simply an Instagram page, and it was called Brown Girls Health. So that is actually what we
Mm.
started as. So it was called Brown Girls Health, and it was basically a social media page where I would post educational things about South Asian women's health. And a big focus of my own on that page was to talk about things that were stigmatized or tabooed. So I would talk a lot about the various women's health topics, whether it was PCOS, mental health, sexual health, reproductive health, things that are often not spoken about. And so it really started in that way. I actually, and when I started, I didn't know if I'd even gain an audience. If other people, sometimes you internalize like, oh, this is important, but other people don't agree. But
Mm-hmm.
to my nice surprise, people agreed and they found it really important, and I was able to grow the community fairly quickly. And from there, I was able to partner with a lot of different types of community members, healthcare providers, to put out more information because they felt like this was such an important mission. And likewise, they felt like nothing like this existed because they didn't really have a place to go for these things, and they didn't really see themselves in media or resources or anywhere. So I was able to grow that very quickly, and people were very passionate about it, like myself. But from there, taking community feedback, I realized, and I felt the need to expand this, but I realized I want to reach more than just women. There's so many more people in the South Asian community that this can impact in a good way. So from there, I slowly rebranded it to South Asian Care to incorporate the whole South Asian community. I wanted to include all different age groups, all different genders, all different types of people, and I wanted to do more. So in addition to just Instagram and social media posts, from there I created a website for South Asian Care. So kind of the three main components on that are our private provider directory, which links people to culturally compassionate care. And it has a resource hub as well where we have different articles, blogs, fact sheets, resources. And then lastly, we still do our virtual events. So we do webinars, workshops on various topics with different experts. And then sticking true to our original path, we still do social media on all our networks. So we have kind of taken a few different avenues and grown to incorporate a lot more people with a broader mission, but still staying true to we want to really give to the South Asian community and bridge those gaps.
Well, that's amazing. Firstly, so kudos to you for taking that on and for building it and seeing the need and then expanding it and continue to build it. I think that says a lot about who you are as a person and the impact that you want to make. So I appreciate you, and I'm giving you thanks from everyone else who appreciates you for creating this space for a community that maybe didn't have a space for it, which I think is awesome. And look forward to seeing like all that you're able to do into the future. Um, so thinking like strategically as a CEO, when you started like the organization, you're already doing or have like this knowledge around social media, communication, your partnerships. What inspired you, or like what was the strategy in building out the directory? And yeah, just tell us more about like what was the how do you come about thinking about these things?
Yeah, it was really cool because I did have, years of experience previously working in different kinds of health campaigns, different health worlds. So I was able to actually use the things I learned and bring it into my own passion and my own work. So I think it was very cool personally how I was able to, translate that into building my own organization. And I think, just having the passion to continue to grow it. And I felt also just kind of like from a personal experience, I've always been looking for culturally compassionate healthcare just as a South Asian woman myself. And just for example, PCOS impacts South Asian women disproportionately, and not all South Asian women who have it are able to get diagnosed easily or even quickly, and it can really impact their quality of life. And, for someone who is culturally compassionate and understands kind of that data behind it or the science behind it, that could help someone get diagnosed a lot more quicker. And so just from my own experience with that, I wanted to make it easier for people to have kind of that better match, that culturally compassionate directory that what they can easily go to, find someone that they're looking for that relates to either their specific condition, their need, or it's a specific language, or even an insurance they're looking for to be accepted. Um, just to have that trust already that they will be given that care and that attention that they need and deserve. So it really kind of, was something that I realized didn't exist, and I wanted to create that for people.
Love that, love that. And I did not know about the PCOS disproportionately affecting South Asian women. So thank you for educating me on that as well.
Yeah.
And what has your day to or what does your day to day look like now? Yeah,
It's definitely a mix. I would say a lot of my time is spent talking with healthcare providers, bringing them onto the platform, hearing their insights, and also working on building different kinds of resources and also planning community events. I also spend a good amount of time on our partnerships, our strategy, and just thinking about how we can continue to grow and keep our work sustainable. So no 2 day looks the same, but I think the common thread is really just focusing on the community and providers that we serve and to continuing to grow this community.
and where do you envision South Asian care heading in the next 1 to 3 years?
Yeah, our vision is to become the go-to platform for South Asians looking for culturally compassionate healthcare. In the next few years, I really want to continue to grow our provider directory so it's truly national and build out a robust resource hub with a lot of evidence-based, culturally relevant content. And also just expand our events, both from virtual to in person, so more people can feel connected and supported. So ultimately, the goal is to make navigating healthcare less isolating and just more empowering for South Asian individuals and families.
That's awesome. And when you started this work, was it geographically bound, or how did all of that come about?
Yeah, since all of our work is virtual and fairly accessible virtually, it has spanned the United States. So I want to, and we have a lot of people mainly from the larger cities in the United States, but I want to continue to grow that. I mean, it'd be amazing if we could create this into a global thing too. Would truly be a dream come true. But just kind of targeting different regions, getting them involved and incorporated would be incredible.
Makes sense. Makes sense. Um, what do you enjoy most about your work, and what is most challenging?
Yeah, what I love most is seeing the impact, I'd have to say, whether it's, a provider feeling supported in reaching their community or someone telling me that they finally found a doctor who gets it. I think those moments remind me why this work matters the most. But of course, there comes challenges with that. So I'd probably say balancing vision and resources. Since we're still a growing organization, there's always more we want to do, and sometimes we don't always have the capacity for it. So it's a constant exercise in prioritizing while keeping with the mission up front and center. So I guess, those are growing pains though.
Yeah, absolutely. And what does that look like for someone in this growing organization? How do you think about prioritization and focusing where you're going to focus your work on?
Yeah, I think the main thing we keep at the forefront is just making sure all our work stays true to our mission. But most recently, since, our transition to South Asian care and building out our directory, that has kind of been on the forefront. So our main two things we've really been focusing on is building out that directory hub and also our resource hub. So as we continue to do that, and as always, on our socials, we're always putting out educational content because we do want to stay engaging and, be the one-stop resource that people can go to learn more.
And how can people listening to this right now support or engage with South Asian care?
Yeah, absolutely. So our Instagram is South Asian Care. We're easy to find and we're always active on there. Separate to that, www.southasiancare.com is our website where you can find, our resource hub or provider directory and a list of all the events happening. So everything you can find on there. And we're always happy to connect with people through messages or emails as well.
Awesome. And I'll link those below or in the show notes so you can check them out there as well. I did have one other question. So you shared earlier that a lot of the work is, if you want to divide it into provider focus, community focus, how do you
Mhm.
balance that?
I a lot of our work, so we do our provider directories, of course, it thrives when we get more providers on it. So I'm always creating connections of people who are really passionate about putting their work out there, connecting with the community. But separately, we are always, we want to give the community what they want and what they find important and what they're looking for. So we're always putting out feedback out there, surveys, polls, questions on what they wanna see from the provider. So it's the balance of taking that information from the community and taking it to those providers that I'm building relationships with and being able to put that into translatable content for the community. So it's a fine balance of both. I've been able to build a pretty robust network with the providers and good relationships with them. So they're truly passionate about putting various topics out there. So we do 1 to 2 webinars per month. They're all on our YouTube page too. So people can always go back and watch them and learn about very different topics. So it's really wonderful to be able to work from the community side, hear their feedback, and then work with the providers to make it all come to life.
Is there anything about South Asian care that I didn't ask that you want to share?
Um, I think, just keeping it as a go-to resource for South Asian care, or sorry, South Asian populations, we're always looking to partner with different types of groups of people too, we're always very passionate because, I think it's not just specific to South Asians. Healthcare is for all and we want to make help in, this strive for equity for everyone. So we're always happy to partner with different types of organizations.
Awesome. And a past week guest question, and I think a question that is important in this day and age is, how do you take care of yourself and stay motivated in this work?
Yes. I am a big, big advocate for self-care. And so I know self-care can mean very different things to everyone, but for myself personally, I think one big thing is nutrition. I like to take care of myself nutritionally, and I know I mentioned a little bit about cooking. So, I that helps me relax by cooking, but it also helps me nourish myself by cooking. So I really enjoy that to take care of myself. Separately, I also really enjoy staying active, doing different things. I love, just getting fresh air, even if it's just for a walk, taking breaks. I think it really helps my mind recharge and rejuvenate for all the things that I do day to day work wise. Um, and then lastly, just spending time with friends and family. That always helps me recharge. And, when I feel like I am recharged, I have the energy, I'm able to put all my energy towards work and, be able to give it my all in that way.
Yep. Love that. And I think it's essential, especially in these times, to find ways to replenish and rejuvenate. Um, I see that I have this question here that I usually take out. It was a question around favorites. Um, did you have anything that you wanted to share around that, or do you want me to just move to the Furious Five?
We can move into the fears.
Okay, awesome. So Nishat, moving into the Furious Five, the 5 questions that I ask all guests. Number 1, what advice would you give to a student trying to pursue a career in public health?
I would say stay curious and get as much real world experience as you can early on. I think public health is such a broad field, and internships, volunteering, or even just sitting in on community meetings can give a lot of insight to what really sparks your interest. So I'd say don't be afraid to explore different paths before you settle into what you'll focus on.
Number two, if you're talking to someone wanting to get into your position as a founder and CEO, what advice would you give them?
I would say be willing to take risks and learn on the go. A lot of my journey, especially starting South Asian Care, came from identifying a need and figuring things out step by step. So I would say build strong communication skills, listen to the communities you want to serve, and don't wait until everything feels perfect before you start.
Great advice. Number three, what's something you're working on improving in your life right now?
We talked a little bit about self-care, but I will say I am still working on creating better balance in my life.
Mm.
So making sure I truly do carve out that time to rest and focus on personal things, cooking, spending time with family while still building South Asian Care. Especially as a founder, sometimes you're building your own schedule, so you have to be able to kind of build that for what works for your life and, to reduce burnout as well. So it's easy to get caught up in the work, but I've realized that balance is, important for sustainability and overall health.
And number four, professionally, do you recommend anything?
I would say, professionally, there's a book called, for anyone in health communications, I'll say Health Communications from Theory to Practice by Renata Shivo. That's probably a really solid foundation and it connects academic insights into real world application.
Well, thank you. I'm probably going to buy that book tonight. So I appreciate that. And then last but not least, if there was one piece of advice you'd give to your younger self, what would it be?
I'd say trust your instincts earlier. I used to second guess myself a lot, especially when it came to making big career moves. But the moments I listened to my gut, like starting Brown Girls Health and South Asian Care, were the ones that really shaped my path the most.
Love that. Love that. Well, Nishat, thank you so much for coming on the podcast, for sharing your story, your insights, and love all that you're doing. And I'm a big supporter and hope that it continues to shine.
Thank you so much for having me today. I'm really happy I could share this all with you.
Yeah, truly, truly is my pleasure. Um, Housekeeping items, everyone. Thank you all so much for watching. Be sure to subscribe and leave a like if you have not as yet. If you're on the podcast platforms, definitely leave a 5-star review and share it with a friend as well. That really helps the show to get out to more people. Appreciate you all. See you all next week. Peace, everyone.